Hi to all the PureChiro patients. I'm Jenny, and today I'm going to take you through a standing posture alignment for all abilities. So please stop if anything causes you any increased pain or discomfort, and please seek some advice from Luke and the team at the PureChiro clinic. However, let us have a little go at this. So we are going to start by thinking about our posture at standing. Our body is designed to be in a certain position. We've got our spine, pelvis, rib cage, arms and legs, head. So those are the areas that we're going to be focusing on and thinking about their positioning and their alignment. We're designed to be in a certain position where we then move much more freely. We can bend, we can twist, we can walk, we can sit, we can stand much more freer and easier the more we are in this good posture. So let us get started. So what we're going to start off is work with the feet and go all the way up through the body. So I'd like you to start off by bringing your feet into a parallel position and about hip distance apart. Yeah? Might feel a bit strange. For those of us that tend to stand with our feet turned out or sort of in one leg, or maybe you stand with your feet a bit wider, this is going to feel different. A lot of these positions I'm suggesting are going to feel different. You're going to feel different muscles working. Come with me, bear with it, see how it feels right at the end. So let's bring your feet into parallel. The weight is going to settle on the right and the left foot. So please make sure you're not favoring one leg, that you do feel like you've got the weight even on the right and the left foot. I'd also like you to think about your big toe, your little toe, and the heel. Now, a nice way to think about this, and is the weight even, is that you've got a triangle on the base of your foot, and you've got 1 point on the big toe, 1 point on the little toe, and 1 point on the heel. So 1, 2, 3. And those 3 points of the triangle on the base of your foot have got even amount of weight. I'm just going to go sideways just so that makes it a bit clearer. So if I've got the weight in my heels, I'm going to stand like this, which allows me to stand like this. And if I shift the weight forward too much, I'm going to end up standing like this and arching, because otherwise I'm going to fall over. So my body, your body, my body are always going to be adjusting to make sure we don't fall over. What do I need to do to level that up? It might not always be the right thing, but it won't let you fall over. So it's always going to keep adjusting. So we're going to think about the weight being even in the right and the left foot and through the triangle. Also, just notice that your little toe and your big toe are in contact with the floor. So you're not rolling out or rolling in. Where you might find that some muscles here feel like they're working a little bit different, or you're just a bit aware of them, or into the calf muscle in the back. That might feel that you go, oh, something feels different. It's just that potentially they're starting to work in a different position to what they're used to. I'd like you to also think about lengthening up the front of your thighs so that it feels like you're opening here. So you're not pulling in and scrunching down. So relax the thigh muscles. But your legs are straight. So again, I just want to go sideways so you're clear on what I'm trying to get you to find. My legs are straight when I'm extending. So they're definitely not bent. I've definitely got them straight, but my thighs are relaxed. So the opposite would be, if I just move my arms, is to brace. Can you see the difference there? I'm bracing, I'm kicking back with my weight, and I'm overlocking with my knee joint. So I'm just going to let go of my knee joint, but can you see that my legs are still straight? Again, that can feel quite different for some of us. Check, have you still got the weight in your big toe, little toe, heel, right and left foot? Pop your hands to your hip bones to the next section. So Quite an important area, as I am sure you know, yeah, is this section, your core, your pelvis, your lower back. Yeah, if something's dysfunctional here, it's going to have a ripple effect through the rest of the body. So it's really important that you're aware of actually what is going on in this area and what can you do to help that, yeah, and help support the body. So hands onto your hips. So find the bony point. I'm just going to lift my top up so it's a bit clearer, I think. Yeah, find the bony point at the front of the pelvis, at the front of the hip bone. And then make sure that your hips are shining straight forwards. So this is always quite useful to do in front of a mirror because you'll see that you may be, oh, I am a little bit twisted. Yeah, I'm rotating round. Or have you got one hip higher than the other? Is it because you tend to shift your weight over? So trying to be imagining and trying to encourage the hip bones to shine straight forward. A good thing I think about and kind of get my clients to think about is that imagine you've got your car headlights here. Yeah, and they've got to shine forward. You don't want them to shine round the corner. You definitely want them to keep shining straight forward. Excuse me. Once you are in this position and you're thinking about the pelvis a bit more, you might start to brace the legs. So just have a little shake out of the legs and check in. With that in mind, if anybody needs to move, if it starts to become quite strong or it makes you feel a little bit dizzy, please move. If you should not be standing on one spot for too long, if you've got blood pressure issues, balance, vertigo issues, if it's not okay, any medical conditions to stand on one spot for too long, please do move and come and join back in. We're going to think about the pelvis at the front and the back a little bit now. And again, I want you to just let your back tip. Sorry, your pelvis tips, your back arches, and then tuck it the opposite way. Now, anybody with any conditions, please just be mindful doing this. Do not move too quickly and don't do too much of this. I'm going to turn sideways so you can see what's happening. So I'd like you to just let your back arch and move the pelvis. And just notice that actually you can move your pelvis. It is movable. We want it to be able to be movable. But what I'd like you to do is imagine your pelvis is a bucket of water and you're going to find the pelvis level by getting the water level. So if my pelvis is like this, the water is pouring out the front. If my pelvis is like this, the water is pouring out the back. So what I'm trying to do is find somewhere in the middle that of those two extreme movements that my pelvis is level. Now, some of you might find that by bringing your pelvis into level position, that your abdominals are starting to pull in, or something's tightened here, or your tummy's just gone a bit flatter. Fabulous. That is your core, your pelvic floor and your lower abdominal muscle. Yeah, that is your core starting to go, oh, I need to do a bit of work now. I will help you support. Also, some of you, it might feel different round here. That's because those muscles, instead of being in that position, tight and scrunched up and shortened, they're now a little bit more lengthened and open. So that is normal. It might feel different. You might need to move and come back into it and move and come back into it. Yeah, but that is where we want to be heading. Let's have a little check-in. Feet, thighs, hips, pelvis and bucket of water. We're then going to think about a piece of string running from the tailbone all the way through the spine and out through the crown of your head, creating some space between each vertebra. You're still encouraging a natural shape, so it's still got its little waves, its little curves, but you're trying not to let anything scrunch and crush up. Yeah? Crushing, that doesn't sound great, does it? Lengthen and open. I'd like you to open up your chest and your collarbone and let your arms settle by your side. Try and create a lovely long gap between your ears and your shoulders. Many of us, I'm not saying all of us, but many of us are like this. Yeah, it's tight up here. It's shortened. We've got a really short neck alignment, which is pulling our head and shoulders forward. I'm going to go sideways. Look, so are you recognizing this? That might be a bit exaggerated, but you might be recognizing that in yourself. If you can encourage your piece of string through the spine, you can open up your collarbone and feel that you're really lengthening your neck. See how that starts to feel different. What that does start to do is get you to use some back muscles up here. So it might be that you can only stay there for a few seconds because you can feel them working. Then you have to go, oh, that's enough. And then you have to come back into that position. It's quite strong work for these upper back muscles. So please be mindful of that, especially if you are having any treatment or have any conditions to do with neck, shoulders, upper back. Yeah, that might be something you just need to really build up slowly. What I'd like you to notice is that your hands and your arms are by your side and they're not in front. If they're in front, see what happens to my shoulders and my head. If I bring them to the side, I have to open up here a little bit more. And the last thing to just be aware, posture pointers, yeah, is your chin. Imagine your chin is on a shelf and it is not poking forward and really tightening these neck muscles. Try and encourage the chin to settle back on the shelf. How is that now feeling? Different? That is good. If it's feeling different, that's okay. Please remember to move. Yeah, if it is not okay, if it's causing pain, move, come back to it. But just be mindful, is it pain or is it an ache that there's a different muscle working? That's what I would be asking yourself, yeah? Have a little check-in from the feet. Feet parallel, weights across the big toe, little toe, heel. Your knees are pointing straight forwards. Your thighs are relaxed. Your pelvis, hip bones are shining forwards. Remember the car headlights? And the bucket of water is feeling level. And that might be for some of you that your tummy's now starting to pull in and start to hold and work. Yeah? Being aware of a piece of string running all the way through the spine and out through the crown of your head. Your collarbone is feeling open and your arms are relaxed by your side. Feel the weight is even still through the triangle. And the last point of posture is to check your head and neck. So imagine your chin is on a shelf and you're sliding your chin back a little bit. Guys, I'm going to go sideways so you can see that from the side. So we're thinking about a lovely long body. We're opening up the body rather than it all scrunching and pulling in. Often our postures are like this, maybe one-legged. And can you see how that's really compounding onto all the joints? Yeah, or if you tend to stand like this, yeah, again, it's all like compound into the joints. Find your stability muscles. We've all got them. Find your postural muscles. We've all got them. Yeah, we just get out of the habit of using them. So last little check-in with your alignment. Guys, it's always a good idea to, if you can, do this in front of a mirror or just have a little check in the mirror after this session. Go and have a little check, even if you can only see the top half of your body. What's happening with your head and neck and shoulders? Can you just find a better position for your body? Guys, always breathing naturally as we are holding this position. We definitely don't want to hold your breath. So team, remember to seek some advice. Ask Luke and the PureChiro team if you need any support. Please stop if there is any increased pain and discomfort. And hopefully you enjoyed and found that video. You enjoyed that video and you found it useful. And I hope to see you all soon.